Hello, my name is Brian Hartl. I work as the epidemiologist at the Kent County Health Department. An epidemiologist is someone who just kind of tracks diseases in our community and helps to prevent the spread of that infection within our community. So we wanted to talk a little bit today about contact tracing. We've had several questions about what it is, how we do it, and so we're going to kind of dive into that a little bit today. So what is contact tracing? It's the way that we identify individuals who are sick with COVID-19. We get those reports to us from hospitals and other laboratories in our community. We in turn call those individuals to identify when they got sick, that first date that they had symptoms, and we use that date to identify individuals who have come in contact with that person to see who is most at risk for becoming ill with COVID-19. So we want to make sure we're calling the individuals who are sick as well as those who are in contact with that sick individual to help control the spread of COVID-19 in our community. We have several people who are doing this in the Kent County Health Department. So typically we have communicable disease staff or nurses do this, staff about 10 or so when we look at vaccine preventable diseases, tuberculosis, or sexually transmitted infection during our normal work. But because we've had over 2,800 cases of COVID-19 here in Kent County, we've had to expand that team to several others. So we have people from our environmental health department, we have nurses from our community wellness division, nurses from our immunization department as well. We have a team of about 60 to 70 Kent County Health Department staff who are now working on contact tracing. We also have some individuals from our community who are volunteering to help us out with this. They come from local universities and just general people in the community who wanted to help out, and they've contacted us, and this is how we're having them help out. So we have a number of people who might be calling people in our community, either Kent County Health Department staff or volunteers from our community. We often get questions about privacy and can we do this when we have things in place like HIPAA that are there to protect people's privacy. So we take privacy and confidentiality very seriously at the health department. We know that anything that we collect is held confidential, and we don't share that with others. But HIPAA, the privacy rule, does allow public health departments to utilize information, which is called protected health information, for activities to prevent and control the spread of diseases. And so we are able to contact individuals who may be at risk for exposure, to talk to them about their potential risk, and identify what they should be doing to monitor their health and to prevent potential further transmission of infection. So it gives us an exemption in public health to be able to utilize this information for preventing and controlling the spread of communicable diseases in our community. How do we do our work? We're mainly doing all of our work via the phone. So when we get a case, we call them via the phone, get in touch with them, ask a bunch of questions. Sometimes we can't get in touch with them, we'll send them a text if we know it's a cell phone. Sometimes we get access to email, and we may send them an email. But the majority of our work is done via the phone. We don't go on knocking on people's doors. We don't drive to their homes. Sometimes we'll send them a letter if we can't get in touch with them. It is important for us to talk to individuals, so if we can't get in touch via those other routes, we'll send a letter. But most of our work is done via the phone. What types of questions do we ask for these investigations? For the initial case, the person who is sick or confirmed with a positive case of COVID-19, we're asking questions about where they have been, have they traveled, do they know maybe where they might have picked up the infection, things that they've done in the community to try to figure out where they got it. We're also asking about their symptoms, what type of symptoms do they have, headache, fever, diarrhea, and things like that. We look for the target date of the onset of their symptoms, because that's what we use to identify those individuals who came into contact with that individual who are most at risk. And so we use that onset date, go back 2 days or 48 hours from that onset of symptoms, and look at all those people that they have been in contact with during that time frame. We're looking at people who were in close contact with them, within 6 feet for 15 minutes or more, who they had physical contact with, like hugging or kissing and things like that. Maybe coming into contact with respiratory secretions of an individual, and also household contacts. Those are the people who are at highest risk for infection. And so those are the types of questions that we ask, and then we ask the contacts the same type of thing. Are you sick? Do you have symptoms? And then we ask them to isolate and quarantine for a period of time to help protect against the spread in our community.